Hey John, Dr. Buford. We're just getting started on the left knee. We're looking on the medial side, the inside part of the knee. This is where you've got a bit of arthritis here. You can see some areas in the articular cartilage that are a little bit rough and irregular. The instrument you see is called a shaver, and it has suction attached to it and spins around very fast. Hold it for a second. That's the shaver. I'm going to try and focus our picture a little bit better. That's pretty good. And so here you can see this part of the femoral condyle where the cartilage is not smooth anymore. The normal cartilage looks something like maybe up here, but this is an area in the weight-bearing part of the knee where it's not smooth. And I think there were some loose pieces coming from here because they came out of the joint once we first started the surgery here. Hold the camera again. We're going to see if we can look towards the back. There's another area. Hopefully we can smooth out some of these areas on the condyle. The meniscus here doesn't look that bad. This is the anterior horn in the body. And that, so far, not so bad. We'll keep working and show you some more in a minute. Pause. Okay, here's the central part of the knee. This is where the anterior cruciate ligament is. That's it right there, running up towards the posterolateral side of the knee. Posterior cruciate ligament inserts right here behind the shaver. You can get a peek up at the trochlea, which is the groove that the kneecap slides in. You can see you've got some wear and tear changes here for sure. We'll be trying to smooth out those areas in a little bit. Pause, please. Okay, so this is the lateral compartment. This is where you've got this big tear in the meniscus. And I'm going to use this pair of scissors to help me trim it out here. It's going to create a lot of loose pieces of meniscus that we'll then take out with our shaver and with suction. But the quickest way to trim this out and get this back to a nice stable rim is using the scissors. As you see us there, now it's getting a little hard to see, so we're going to go ahead and put our shaver in. Clean some of this up here a little bit. And unfortunately, it looks like most of the lateral meniscus is going to have to go because it's all torn. You've got some arthritic change on the condyle as well. You can see at the top, but none of that looks too loose, at least not yet. Maybe here there's some loose areas. See right there? But right now, we're going to focus a little bit more on the meniscus here. Pause, please. Trying to time cleaning out this lateral compartment. Obviously, you still have a fair amount of arthritis, enough that where if your knee continues to bother you, and we can't get it under control with some conservative things, you might be heading towards a knee replacement the way the cartilage is looking here, and that there really isn't any cartilage in a large part of the condyle and on the tibial plateau down below, especially as you get towards the back. But I just wanted to show you that meniscus tear that was here, that looked all ugly and nasty, is now completely gone, so hopefully that won't cause any problems going forward. There's a little part of the anterior horn of the meniscus that we need to trim out. Okay, so now we're going to go ahead and have a look at the patella. And we already had that glimpse of it, so we know there's some arthritic change here, and sure enough, this view kind of confirms what we suspected. Suction. Nope.